COVID-19 vaccine, what to do about side effects. This article examines over-the-counter and home treatments for COVID-19 vaccination adverse effects. All facts and statistics are based on information that was publicly accessible at the time of publishing. Some of the material on this page may be out of current. For the most up-to-date information on the COVID-19 pandemic, visit our coronavirus portal and follow our live updates page. All vaccinations, including those for COVID-19, may have adverse effects. There are now 15 COVID-19 vaccines approved for use in at least one nation throughout the world. According to the World Health Organization, the most frequent adverse effects of COVID-19 vaccinations include tiredness, fever, headaches, body pains, chills, nausea, diarrhea, and discomfort at the injection site. Vaccination affects everyone differently. Some people may have little or no adverse effects, whilst others may have several negative effects and feel quite sick. In this article, we will discuss what to do if you have adverse effects from a COVID-19 vaccination. Over-the-counter medications. Anyone concerned about the adverse effects of vaccination may question if they should take an over-the-counter medicine prior to receiving the vaccine to prevent any side effects from occurring. The Centers for Disease Control and Prevention, CDC, trusted source, on the other hand, does not endorse it. While taking precautions to avoid signs of other health problems is a good idea, this is not the case here. It is preferable to wait and observe whether any adverse effects occur, then address them individually, rather than speculating and taking multiple over-the-counter medicines ahead of time. To alleviate the adverse effects of the vaccination, people should consult their local pharmacist before using any over-the-counter medicines. Because a pharmacist is familiar with a person's drugs and medical history, they have a strong grasp of any potential interactions. But what if a person is unable to reach their pharmacist and requires quick treatment from muscular pains, injection site discomfort, fever, or a combination of these symptoms? In this scenario, the following suggestions may be useful: acetaminophen, paracetamol, or ibuprofen, Advil, Tylenol, aspirin. Natural cures. If you prefer not to use over-the-counter drugs or are searching for alternative therapies, there are numerous self-care approaches that can help alleviate any COVID-19 vaccine after effects. To treat responses at the injection site, such as discomfort or swelling, make a compress using a clean, cold, damp towel. This might also assist with muscular and joint pain. Move your arm as much as possible to relieve pain or stiffness. This may appear paradoxical and may cause some discomfort, but it helps avoid additional stiffness by relaxing strained muscles. Drink plenty of water if you have chills and a low-grade fever to avoid dehydration. Wearing light clothing and wearing in layers will help keep you cool. What exactly is a COVID arm? This is a possible adverse effect of the Moderna COVID-19 vaccine. It is a red, blotchy rash that might occur around the injection site, usually approximately 7 days after getting the first dose of vaccination, but this can vary. While the rash's appearance may be worrisome, it is not life-threatening. If the rash becomes uncomfortable, apply a cold compress, such as a cool, clean damp washcloth or an ice pack wrapped in a towel. Another alternative is to consult with a pharmacist to see if taking an antihistamine, such as diphenhydramine, Benadryl, is safe. Antihistamines can cause drowsiness, therefore drivers should avoid driving until they are confident of the medication's effects. The rash usually lasts 5 days, although it can last up to 3 weeks. There is no need to be concerned if it appears after and lasts longer than other vaccination adverse effects. How long does it take for the adverse effects to go off? COVID-19 vaccination side effects should only last a few days. If they persist, consult a doctor. Some of the adverse effects of COVID-19 include fever, chills, and tiredness. It is possible to contract SARS-CoV-2 before or after taking the vaccination, before the body has a chance to generate the necessary antibodies and acquire protection. Furthermore, while the vaccinations are highly efficient, they may not provide complete protection against the virus. It is critical to remember that no vaccination may induce COVID-19 since none of them contain the full SARS-CoV-2 virus. Anyone who contracts COVID-19 after getting the vaccination was most likely exposed to the virus before developing adequate protection. If side effects resembling COVID-19 symptoms continue, get a COVID-19 test and follow local self-isolation recommendations. When to consult a pharmacist. A pharmacist can assist in determining if over-the-counter drugs are safe and appropriate for each individual, and if so, which alternatives are the best. They take into account a person's medical history and ensure that any over-the-counter drugs will not interfere with other medications. A pharmacist can also offer home treatments and advise you on whether you should see a doctor. They can also explain how to take a medicine, how it works, and what adverse effects to avoid. When should you see a doctor? If any adverse effects get considerably severe, seek medical attention. This might result in severe discomfort, agony, or redness at the injection site. Seek medical attention if any adverse effects linger more than a few days. Trusted. Anyone who believes they are having a severe adverse response to the vaccination should dial 911 or seek immediate medical treatment. This response, which can result in anaphylaxis, can include trouble breathing, throat closure, face swelling, and hives. These vaccination responses are extremely uncommon, with anaphylaxis affecting 2 to 5 of every 1 million persons who receive a COVID-19 immunization. Anaphylactic responses to vaccines typically develop fast. A person will be monitored by a healthcare practitioner for around 15 minutes after receiving a dose of the vaccination. This is done to guarantee that if an allergic response develops, medical experts are ready to address it. Side effects are being monitored. We discussed some of the most frequent side effects of the vaccination above. But encountering additional negative symptoms does not always signal that something is wrong. Side effects demonstrate that the vaccination is effective, that the body is producing antibodies and establishing immunological memory in preparation for future SARS-CoV-2 infections. Everyone reacts differently to vaccinations, and some people have more severe side effects than others. The degree of side effects is unrelated to the body's immune level. After getting a vaccine, people in the United States should consider installing the CDC's Be Safe app trusted source. This software allows users to monitor and report adverse effects. It also allows the CDC to contact the individual and inquire about the claimed effects. The CDC can gather data in real time and track trends in adverse reactions thanks to Be Safe. It also has a reminder function for those who take the vaccination in 2 doses.